Dr. Pasha performs many procedures that focus on snoring. For the majority of patients, snoring occurs when the back of the throat vibrates rapidly when you breathe through the night. This most commonly occurs with the soft palate and uvula. The soft palate begins at the junction of the roof of the mouth, after the hard bony portion of the roof becomes soft. You can feel this junction with your tongue or finger. The soft palate ends as an arch with a bell in the back of your throat called the uvula. This area is also called the snoring center, and for most patients, this area is where the sound of snoring originates. There are three primary methods to reduce the snoring. One is to reduce the size of the soft palate by removing the bottom portion. Second is to stiffen the soft palate so it doesn't vibrate. And finally, you may perform a combination of the two techniques. Significant removal of the soft palate is performed in the operating room and is covered in another section. That procedure is called a uvulophryngoplasty, or more commonly, a UP3. The pillar procedure is an FDA-approved technique that can be used for snorers as well as those who have mild sleep apnea. The pillar procedure can also be used in conjunction with other techniques to address the soft palate directly to reduce snoring. Dr. Pasha is the leading provider of the pillar procedure in the greater Houston area. The pillar procedure may be performed in the office or in the operating room while you are asleep. During the pillar procedure, 3 tiny polyester implants are placed in the soft palate. With time averaging 4 to 6 weeks, the implants stimulate your body to form scar tissue, adding structural support to and stiffening the palate. This stiffening reduces the tissue vibration that can cause snoring and palatal tissue collapse. Although we cannot guarantee success for everyone, clinical studies have shown that the pillar procedure reduces snoring with an 80% bed partner satisfaction rate and can reduce the severity of sleep apnea. The pillar implant system has minimal complications. The most common is that the implant may come out. This is called extrusion. Extrusion of the implant occurs slowly and often is only partially extruded. If this occurs, Dr. Pasha may replace the implant or leave it depending on how long the implant has been in place. For many patients, your uvula, or the bell in the back of your throat, may be enlarged or elongated. The pillar implants are only placed into the soft palate, not into the uvula. For these circumstances, Dr. Pasha may recommend a uvulectomy or removal of the uvula. This may be performed in the office using a little local anesthesia or in the operating room while you are asleep. Removing the uvula causes a sore throat for 7 to 10 days, and the discomfort may extend a few weeks afterwards. You will be given pain medication and antibiotics to control the discomfort. Dr. Pasha requires you to take time off of work or school while you heal from a uvulectomy. Uvulectomies are low-risk procedures with a potential of bleeding. Again, no guarantees can be made regarding the success of this procedure. However, studies have shown that removal of the uvula can result in a decrease or elimination of snoring and reduction of gasping from sleep apnea. Another common variation to the pillar procedure is from those who have a progressively sagging palate. If you experienced worsening snoring as you have advanced in age, your palate may be sagging progressively. If this looseness is excessive, Dr. Pasha may also recommend removal of the bottom edge of the soft palate. This technique is performed similarly to a uvulectomy and also can require the removal of the uvula. The recovery and risks are similar to a uvulectomy. Removing the bottom portion of the soft palate causes a scar to form on the bottom portion of the soft palate. This may act as a hammock to reduce the chances of further progression of the soft palate from increased sagging. Finally, if you have enlarged tonsils or significant redundant floppy tissue on the sides of the back of your throat, Dr. Pasha may also recommend a tonsillectomy. The tonsils are lymphatic tissue that are shaped like a ball and live in a pocket in the back of your throat. If enlarged, this may contribute to snoring and sleep apnea. This procedure may only be done in the operating room while you are asleep. Prior to placing any implants or removal of the bottom portion of the soft palate, Dr. Pasha will perform a standard tonsillectomy. The tonsils are removed using a number of techniques, most commonly with electrocautery or a new technique called coblation that vibrates the tissue. You may anticipate a sore throat for 7 to 10 days with the discomfort lasting a few weeks afterward. The biggest risk of a tonsillectomy is bleeding. For adults, this risk is approximately 1%. If this occurs, you may have to return to the operating room to control and stem the bleeding. Removal of the tonsils have been shown time and time again to have no risk in increasing infection. In fact, by removing your tonsils, you may have a decrease in throat infections. We hope this presentation on the pillar procedure and its variations has been informative. If you have more questions or concerns, please discuss them with Dr. Pasha and his staff. We look forward to helping you breathe freely both day and night.